Hi, I'm Robin. I'm a dental hygienist and myofunctional therapist, and I talk about all things oral health. Today I'm talking about tethered oral tissues, or tongue ties and lip ties. The most common are tongue ties, lip ties, and then there are buccal ties as well in the cheeks. When the tissues are restricted, they affect how a child eats, speaks, breathes, and grows and develops. So things you might notice in an infant if they could have tethered oral tissues or a tongue and lip tie are clicking when they are eating, difficulty latching or staying latched, prolonged feeding times, poor weight gain, reflux like symptoms, gassy and fussy feedings. You might notice a very white coating over the tongue that doesn't seem to go away. Parents often sense that something isn't right, so trust your gut and get checked out for that. Signs and symptoms in young children that you might notice. They could have difficulty chewing or swallowing food, maybe gagging on food, pouching food in their cheeks, being very picky with their food and their eating, speech articulation, speech challenges, mouth breathing, snoring, restless sleep, and tongue thrust or low tongue posture. They're often contributed to tongue mobility or the lack of tongue mobility. Things we notice in the dental office when we see kiddos with these situations are narrow, high-arched palates, crowded teeth, gaps or gum irritations around the areas of the tight tissue, open mouth posture, and some jaw clenching and tension in the jaw and upper neck muscles. Because the tongue plays a key role in shaping the palate, if the tongue is resting too low and it's tethered down and it can't get its full mobility, it doesn't rest up against the palate and help to naturally widen and develop that arch. So it can develop issues with your facial growth over time. Some things we notice over time with tethered oral tissues are poor sleep quality, fatigue, difficulty focusing, irritability, emotional regulation problems, head and neck tension. These signs and symptoms often get mistaken for other situations and they aren't contributed to those tethered oral tissues. So always nice to have those checked out and evaluated by a professional. Early intervention is key because the sooner you can identify a tether and treat it, the less compensations your body makes for having that tissue tied. For example, if your tongue is tied and it's not getting its mobility, then your other facial muscles are going to compensate for your swallow and your speech, and then it just makes it that much harder to reverse those or correct those later on. It just takes more therapy, but it can definitely be done, but earlier intervention always makes it easier to treat. Also, just because someone has a tethered tissue or a tight lip or tongue doesn't necessarily mean they need treated, but it's definitely something that should be evaluated to make sure that it's not causing other connected situations in the body with neck tension or whatnot. We definitely base treatment on symptoms and symptom alleviation, not just the appearance of the tissue. So that's something to keep in mind. Just because you see a tissue that looks tight, it doesn't necessarily mean that it's causing problems. So a full evaluation is definitely key. So if you feel like these things maybe apply to your infant or child, go get an evaluation by an airway focused dentist or a professional who can evaluate tethered oral tissues. And if you have any more questions, let me know.